Why do some stroke patients recover dramatically with tPA? Imagine a stroke happening and a blood clot blocking an artery in the brain. This cuts off oxygen and nutrients, causing brain cells to die if not treated quickly. When this happens, every minute counts. Tissue plasminogen activator, or tPA, is a medication that can dissolve these clots and restore blood flow. This can save brain tissue and lead to remarkable recoveries in some patients. tPA works by targeting the fibrin protein in blood clots. It activates an enzyme called plasmin, which breaks down fibrin and dissolves the clot. This process can reopen blocked arteries, allowing blood to reach the affected brain areas again. Because tPA is selective for clot-bound plasminogen, it causes fewer side effects than older clot-busting drugs, but it still carries a risk of bleeding. Timing is everything with tPA. The sooner it is given after stroke symptoms start, the better the chances of a good recovery. Current guidelines recommend administering tPA within 4.5 hours of symptom onset. The greatest benefits are seen when given within the first 3 hours. After this window, the risk of bleeding in the brain increases and the potential benefits decrease. That's why rapid recognition of stroke symptoms and quick transport to a hospital are vital. Not everyone with a stroke is eligible for tPA. Doctors evaluate each patient carefully, considering their medical history, the time since symptoms began, and other health factors. Patients with recent surgery, uncontrolled high blood pressure, active bleeding, or a history of brain hemorrhage are usually not candidates because of increased risks. When administered to the right patient at the right time, tPA can lead to dramatic improvements. Some patients experience rapid relief of symptoms like weakness, speech problems, or vision loss. The extent of recovery depends on factors such as the size and location of the clot, how much brain tissue was at risk but not yet permanently damaged, and how quickly blood flow is restored. The reason some patients recover so dramatically is that restoring blood flow can save brain tissue that was starved of oxygen but not yet dead. This area, called the penumbra, can sometimes be rescued if blood flow is re-established quickly. The faster the clot is dissolved, the more brain tissue can be preserved, leading to better functional outcomes. However, recovery varies. Some patients only see partial improvement, and others may not improve much at all. Factors influencing this include the initial severity of brain injury, other health conditions, and individual differences in how the brain responds to injury and treatment. While tPA can be life-changing, it is not without risks. The most serious complication is bleeding in the brain, which can be fatal. That's why careful monitoring in a hospital setting is essential during and after treatment. Sometimes, tPA is combined with procedures like mechanical thrombectomy, where a device is used to physically remove the clot. This combined approach can further improve outcomes, especially for large artery blockages. Beyond breaking down clots, emerging research suggests that tPA might have other effects in the brain, such as influencing cell survival pathways. But these effects are still being studied and are not the main reason for its use in stroke care. The primary benefit remains its ability to quickly restore blood flow by dissolving the clot. For viewers, the key points are that stroke is a medical emergency where time is brain. tPA can dramatically improve outcomes when given promptly and to suitable candidates. Not everyone qualifies, and the risks must be managed carefully by healthcare professionals. Recovery varies from person to person, and always seeking immediate medical help at the first signs of stroke is crucial. Remember, this information aligns with current medical guidelines and scientific consensus, but individual cases are unique. Always consult healthcare providers for personalized advice.